Hi, everybody, and welcome to another episode of our Two Dads COVID-19 support sessions. Again, the content of these episodes just seems to be getting better and better, and the response from the industry also has been really overwhelming. And today's guest is no different. I'm joined today by Sue Ingamells, who works as one of the clinical directors and consultants for Wessex Fertility that are based in Southampton. The reason why I'm so thrilled to be joined by Sue today is that Sue, her repertoire is extensive, so bear with me. She trained as an obstetrician and gynecologist in Southampton and in Salisbury, and has worked in infertility since 1995. Sue has worked with Wessex Fertility since 1999. And her PhD at the University of Southampton was on the subject of ovarian function. She was also a Wellcome Trust Clinical Research Fellow in molecular biology and endometrial function, and she's especially trained in fertility and women's health. Wow. I'm honoured to be joined by Dr. Sue Ingamells today. So, Sue, how are you?
Yes, I'm very well. It's a pleasure to join you today.
No, it's an absolute pleasure to have you with us. So thank you. I can clearly see you're already busy and at it. So I'm not gonna keep you too long. So let me just quickly start by asking how you are.
Yes, no, we're all well. We're still continuing to provide scans in the clinic and to see patients who have problems from their IVF treatment before the shutdown. So we're self-isolating so that we can come to work and keep everybody safe. Wow. So our patients were all advised to self-isolate, so we've done the same. So we just have a little core team still working, composed of one of the patient support staff, a nurse, embryologist to look after the lab, and myself.
Amazing, amazing. Well, look, on behalf of the trying to conceive community, thank you. Thank you. Okay, let's look at your question. So we're focusing on those patients whose treatments have been suspended, really, and the impact. So first of all, for those watching, who's affected by the suspension of treatment, and I guess when did you see or treat your last patient?
So we did our last egg recovery on the 1st of April. All our patients in the last sort of 2 weeks had to have their embryos frozen. They couldn't have fresh embryo transfers. Those that weren't at the point of stimulation all had to be cancelled. The HFEA imposed some very strict measures on the clinics to make sure that we're all shut down. And the main reason was, well, apart from needing to self-isolate and not spread the virus, but also was to protect the NHS from any complications and miscarriages, ectopics, those sort of things, ovarian hyperstimulation. So that's why we had to shut down. And we will be waiting for the HFEA to give us the go-ahead for when we open up. But there's a lot of work going on in all the clinics in the meantime.
Yeah, which is exactly what I'm hearing. It just seems never ending. There's just, you know, if it's not been the postponement, it's then the prioritization of restarting.
Yes, so we put in a lot of plans already. Everybody has had their treatment reviewed, treatment prescriptions have all been prepared. Their names are all on big spreadsheets as to what they need when they start again. And we'll be able to do telephone consentings and delivering of the drugs and get everything in place so that as soon as we get a hint that we can start, that will all start, and then we can get going. So we've got some good plans to get started again.
It sounds it. Well, I don't expect anything less from you. So what advice are you giving to your patients at this time? And I'm assuming there's regular contact?
Yeah, so we put together a newsletter that's going out on our portal to those people who are waiting for treatment. They sent the first one out last week. We're also doing webinars. So we're doing webinars on a Tuesday lunchtime to those people who are wanting to start treatment to learn about the IVF. And then those patients who are contacting us, we're making sure that we've kept a record of them so that they know what to do. The group, I think, that are having the most problems are those who were perhaps having to have some pre-treatment before their IVF, those ladies who have really bad endometriosis. And I've probably got about 10 of those ladies now who we put in a sort of a holding treatment for them so that their endometriosis doesn't flare up after their recent surgery. I feel really sorry for them because their symptoms are bad, and the side effects of the medication that they're now on is also not really very pleasant. So we are trying to keep in touch, very regular contact. But what we are advising all our patients is to get as healthy as they possibly can. So to use this holding space to eat well, to look after themselves, to exercise well, lose or gain a little bit of weight, just improve things as much as they can.
Wow. Amazing. That was a group of patients that I hadn't even considered.
Yeah.
That, you know, friends that I have that have endometriosis that you know regularly just are uncomfortable and suffer, and then not thinking of those going through treatment, what they all must be going through. Oh my word. Okay, then, so I guess with so many patients that have had postponed or cancelled treatments, and those patients that I guess are in limbo, do you think the industry will have to work in phases to restart because of the sheer volume?
Well, I think the first phase will be very straightforward because that won't be involving the lab, because there will be a phase where we've got people taking medication, having screening, having blood tests. That will all just run because we've got more than the capacity we need to do that. It's when we start the actual IVF work and making sure that the laboratory can get a hold of the culture media. Culture media comes from Europe, so you know, will that be able to be imported? How will we be able to get hold of that? Will we get a good supply of that? And then the other thing is that we've been hearing and working out what protective equipment we're going to need, because we are all going to need to wear the masks, the gloves, the gowns, and everything else while we're doing egg collections, which of course hasn't been standard in the past.
Again, you just for those not aware of this industry, it's that's going to feel completely alien to staff and to patients because it's such a personalized service and quite often quite an anxious service to be greeted by, and I'm sure all staff will still be smiling beneath the masks and everything. It must feel quite strange for you guys going into this new normal.
Yes, it does. Already, you know, just keeping everything clean in the clinic, all the gels and everything else we have to use. And we have to be so careful with the laboratory as well, because we don't want to have these fumes in the atmosphere of the clinic, because that can also affect the embryos. But I do think the new normal will become normal. We'll very quickly get used to it. But I think one thing that we have learned over the last month really is how much we can do by telephone, how much we can do by Skype. We already do our IVF consents online, and so that'll be extended to, I think, much more of our work. I think we'll be able to provide a better service with evening, you know, telephone calls for follow-ups, and perhaps be able to work more remotely but more effectively. So I think there will be less face-to-face work, but much more like this.
Yeah, I couldn't agree with you more. I think what this is teaching us all, you know, not only are we all having to take stock a little bit and maybe slow down temporarily, but look how effective we can be with the use of technology and be a bit smarter. Yes. I'm definitely seeing how this is going to change industries just from that perspective, and you know, home working possibly being more common, but certainly more video technology being used.
Yes, I think that's right.
I guess we touched on that last question, but is there anything else you'd like to add in terms of what we think the new normal will look like? We obviously think technology is going to be more important. Is there anything else?
I think there will be much more focus on people's health. So I think what we have seen, certainly with the last frozen cycles that we did, our pregnancy rate was just fantastic. These were people who suddenly were sitting at home, much more chilled, looking after themselves really well. And we think that is translating into the ongoing pregnancies. So perhaps this will allow everyone to have a bit more focus on what is needed to look after themselves, and we will see that better. What we also are seeing on the other side is a few more spontaneous pregnancies, and so I think there's a bit of more activity perhaps in that area, and because people are at home, they're becoming pregnant perhaps when they didn't think they could. So I've had 2 contacts today for spontaneous.
No way! Oh my word!
Yes. Yeah.
Amazing.
Yeah.
And it's lovely to be able to chat to you, because I know you're super busy. So thank you for giving your time for this. Any last final tips that you'd like to give anybody out there that's listening?
I think do keep trying. That would be the thing I would say. Don't give up and wait for the IVF units to open. Do keep an eye on our website and the other IVF unit websites, because they are putting a lot of information out, trying to keep in touch with everybody. And they all are still doing consultations. So I'm doing 3 days a week full on of consultations for new patients, review patients. And just keep in touch, I think, is the main thing.
Perfect. An absolute pleasure chatting to you. I know you've got a busy day ahead of you. So Dr. Sue Ingamells, thank you so much for joining us. It's been an absolute pleasure. You take care and stay safe. Thank you.
Okay, thank you. Bye-bye.
Take care. Bye-bye.
If you like what you've seen so far, head over to our website at www.TwoDaddies.Co.UK. There you can read our blog and subscribe to our newsletter. Or find us on Facebook and Instagram, simply searching at TwoDads.U.K.